go ahead and start with a brief introduction. Welcome to the webinar on engaging and strengthening partnerships. These presentations and trainings are held specifically for and by the Archer Initiative. The Archer Initiative stands for Advancing Resilience for Community Health and Emergency Response. So all of the emergency preparedness topics that we'll be talking about under this initiative are designed for community health centers. Briefly, as I mentioned, the Archer Initiative has participation from more than 10 states. It's funded by the Centene Foundation for Quality Healthcare and held in partnership by the Association of Clinicians for the Underserved. Our objectives of this program is to build capacity and train, provide technical assistance for providers and operational staffs on emergency preparedness topics. Our hope is to create regional and national and region-specific training resources to help community health centers specifically understanding the experience that we've all endured over the past several years. Briefly, what you see on the slide there are an example of some of our past trainings that we've held. You can always access them from our website, as well as a list on the right of the upcoming webinars. So thank you all for joining today. My name is Angie M. I am a research manager at Healthcare Ready. I am not your host for today. I'm just opening up these slides. But Melanie Mackin, my colleague and lead research analyst, will be walking through the presentation and training for today. Briefly, a bit about Healthcare Ready and our background. We are a national nonprofit 501c3 nationally focused on preparedness and response activities. We serve as the critical linchpin between the public and private sectors that includes federal, state, and local government, as well as NGOs, businesses, and health centers, PCAs like yours, to ensure that as we're responding to coordinating for disasters, we are supporting a marked improvement in how we're able to ensure that patients continue to have access to care and that we're able to coordinate and talk more to ensure that we minimize the disruption to healthcare. So really excited to be with you all today and just excited for all of you here. Briefly, I want to run a couple polls just to get to know everyone where we're coming from today. And the first poll is, have you participated in any of our previous webinars? That gives us a sense for what level of experience or background you're coming in with. We'll go ahead and run this for a few more seconds. Wonderful, awesome. So many of you have, most of you have not previously participated in these trainings before. Excellent. This is not like Game of Thrones. You can totally come in the middle and get what we're talking about. So wonderful. Thanks for those who responded. And then the next poll, wanted to get a sense for everyone's backgrounds and experience in emergency preparedness. So typically we have a wide range of folks that sign up for these webinars. They include anyone from C-suite and directors to folks who are on staff, administrative staff, running EP programs for your health center. So this helps us get to know you and make sure that we're providing materials that meets your needs. Okay, so we have a couple of folks that are new, but it looks like most have a lot of experience, more than 2 years of experience in emergency preparedness. Excellent. That's really good to know because as we go into the agenda for today, we'll start with objectives and icebreakers for the training. We'll talk a lot about partnerships, what it's about. But there's also an opportunity here, and we encourage learning from one another, knowing that everyone comes in with such rich experiences or questions coming out of COVID. We want to make sure that this is valuable to you. So we'll be looking at the chat and the Q&A. Feel free to use them liberally throughout. If you raise your hand, we're happy to bring you off mute so that you can ask your questions or share your comments and experiences. All right, so the objectives. These are our goals for today's discussion. We want to make sure that we're digging into partnerships in a way that helps you not only look at your current partnership, but also to assess outstanding needs that can be filled through the support and encouragement of additional relationships throughout your community. We'll spend some time talking about the roles and responsibilities of partners that your health center might work with, and how they can help you in your mission and your space for healthcare delivery. And finally, we'll go over what it looks like to form new partnerships, as how you sustain existing partnerships, especially while managing all of our workloads, and given where we're at beyond the pandemic, or as we're recovering from the pandemic. Right. If there are things on the agenda that we didn't mention, I'm going to just drop the list for the agenda here in the chat. Or in the objectives that we didn't cover. Again, please feel free to drop in the chat. We're happy to touch on them throughout this conversation, or to follow up with additional materials. With that, I wanted to ask the group here, and it looks like we have a really small group today. So again, happy to hear your voices throughout as well. I'm interested in knowing, what do you hope to gain from this training? So again, please feel free to, if you hover over your Zoom webinar, you should see an option for the chat. It's a little message bubble. Would like to hear from you what you hope to gain from today's training. Some examples, what we've heard from past discussions like this is just, how to identify community partners, which ones you should be working with, or just information or tips on how to engage more deeply and build strong relationships with your community partners. So, who you should be working with? That's an excellent question to have. We'll cover that as well today. Building and sustaining better partnerships that benefit both parties. Absolutely. Sustainability is all about making sure that there's skin in the game for both of you. So we'll cover that as well. Also, the message for reaching out to them to represent both, what you're doing, and also what you can be, what benefits they have in engaging in the partnership. Absolutely. Ways to enhance and strengthen our partnerships, as well as how to build new partnerships. Excellent. These are really great topics to hear. Feel free to continue dropping in the chat. Also wanted to raise the question to this group here. And yes, the recording will be, and the PowerPoint will be made available on our website, and also emailed to participants for the call. Would like to run the next poll for everyone here. Where are you joining us from? We know that several of you are here from different states. So the reason why we ask what HHS region you're joining from is because a lot of emergency preparedness resources or infrastructure comes from these HHS regions. So wanted to get a sense for where we have participants today. Also, so that you have an opportunity to get to know one another for potential future tabletops or opportunities to work with one another. I see that most of us here today are from Region 3 and Region 4. I know that we have I know that we have a ton of folks from Region 4, and I see a couple of people trickling in from Region 2. And that's because Archer Initiative is also meant in part to focus on these areas that are at highest risk for natural disasters, for emergency preparedness. We want to ensure that these resources are making out to those CHCs. So thank you all for sharing where you're coming from today. With that, I'd like to hand it over to my colleague, Melanie, to introduce herself, as well as take it off with the rest of the presentation.
Awesome. Thanks so much, Angie. My name is Melanie. I'm the lead research analyst with Healthcare Ready. I primarily focus on our health security portfolio. So working with different healthcare facilities to strengthen their preparedness and response capabilities so they're more ready for the next disaster. So I'm going to start this training off by introducing some overarching concepts and definitions about partnerships in the healthcare and public health sector, just to really help set that baseline about what we're looking at as we go through this conversation. So first and foremost, I just want to go over why partnerships are so important. There are many different angles to partnerships, and there really is no right or wrong answer. It may sound like a given that partnerships are important, but it is useful to name and articulate why we are stronger and more resilient when we lean into and leverage those partnerships, especially during emergency response than we are as individual organizations. Almost by default, an emergency requires partnerships because an emergency really stretches the limits of what we can do alone. We need those partnerships to be able to know where we can go to for additional resources and to get information, as well as triage needs based on the resources that we have available across our partners. You know, COVID really taught us that when resources are limited and strained, it's those established and trusted partnerships that we can really lean into for support. So partnerships can help to benefit your health center in so many ways. We have a few on the board here. So just to name a few, they can help you understand where you can turn to for needed resources and expertise. They can also help to increase your center's situational awareness during a disaster and help you know where you're most needed and where you can put your limited resources to support your community and focus on your patients' most critical needs. And then finally, partnerships establish a foundation of trust, not only between you and your partners, but with your whole community. So while we know that partnerships are important, one challenge that we can run into is that not everyone speaks the same language. So it's really important to recognize that language used across partnerships, especially during an emergency response. They can change depending on the organization, their sector, and what phase of the disaster cycle they're currently operating in. So what one person in state or local government might call an activation, someone in the private sector might be calling it an emergency response. So recognizing these differences in terminology helps you know what to expect when working with different partners, and it can help to prevent possible miscommunication. You know, when in doubt, we find it really helpful to be clear in our definitions when we're working with a new external partner, just to ensure that everyone is on the same page. And during an event, you know, miscommunication can really make or break a response. So we think that having some base level of understanding of those terms can really help when you're entering into a new partnership and can be really helpful when it matters most during a disaster. So similar to how language can change across individuals or organizations and times of response, emergency powers and who is involved in a given response may also change based on the scale of that response and the type. So it's important to know which levels of partners provide which type of support so that you can know who to rely on for different needs. So starting on the left with local authorities, they typically have first jurisdiction and they manage things like curfew, access and reentry for employers or vendors that are trying to enter a disaster area. They're also the first point of contact for things like resource needs, and they support shelters and power restoration. Moving on to states, they have the authorities to make regulatory decisions like prescription refill policies or healthcare provider licensing waivers. Additionally, they may also make executive orders or disaster declarations following an event, which can help move resources and support into an affected area. And then federal agencies on the right, they also have the ability to make disaster declarations that provide individual or public assistance to impacted individuals or communities. They can activate the Emergency Prescription Assistance Program, which is also known as EPAP, which allows uninsured individuals to access their emergency refills of their prescription medicines. You know, looking at this slide, I just want to note that over the last few years, there's been kind of a shift in moving control to local authorities or local governments during a disaster. So you may see the message of locally executed, state managed, and federally supported as a mantra for how emergency management is operating.
And this is just a really reflection of what we know, which is that disasters are localized events. And at every level, everyone is aligned in that understanding to ensuring that local authorities have what they need and they're supported to lead their emergency response. So now that we've talked a little bit about why partnerships are in general and some of the structures that you may see, we're going to start thinking about mapping out the partners that you all have as community health centers. So there are really two broad categories when we think about partnerships, those being internal and external. I think oftentimes we skip over what our partnerships may look like within our own organization. So we provided a few examples here of some internal partnerships that you all may have at your community health center. And when we talk about internal partnerships, it's really important that we have buy-in across the entire organization for the work that needs to happen. You know, with those strong internal partnerships, you'll be able to leverage capacity from within your own community health center when it's needed most. One example of this may be between people who work on supply chain and your clinical team. You know, when there's a situation like COVID and your facility is experiencing a shortage, how quickly is your supply chain group able to work with your clinical group to identify substitutions or implement conservation or preservation strategies? Now, when we think about external partnerships, we really mean those persons or those organizations outside of your community health center. You know, so looking at some of your goals that you posted in the chat earlier, it's really evident that you all understand the value in some of these external partnerships within the context of disaster preparedness and response, and the value of building community-wide capabilities and readiness. I think something that we've seen historically is that determining how to get partners outside of your organization to invest in preparedness can be really challenging at times. However, if anything good came from COVID, I think that we are at a time where external partners really do see and understand the value of being involved in preparedness. And they do actually want to get involved. So there's more of this shared value across the community right now. And we're really, we really encourage you and your partners to take advantage of this moment and work to build on some of those community-wide capabilities through partnerships. All right, so we're going to go through a partnership mapping exercise. I'll attach the document in the chat, but we also sent it over email earlier today, so you should also have it there. But if you're calling in, you can just feel free to jot these notes down on a piece of paper as well. Whatever works as you're tuning into this webinar. So before we dive in, I want to ask you all just to first think about a few things. First being, are there clear lead organizations that would be your partners during a disaster? And then think about if that would change before a disaster. So we know a lot of you are in Region 4, thinking about a notice event like a hurricane. If you've been tracking the system for a couple of days, who would you tap into for preparedness messaging or activities? And then longer term, think about recovery. Are there a different set of partners that you may reach out to work on some of those longer term needs? So as you're thinking about this, I'm just going to put up a poll that asks you to think about your partnerships in the context of when they occur across the disaster cycle. So just thinking about, does who your community health center work with change depending on whether you're in the preparedness phase, the response phase, or the recovery phase? All right, so we're seeing a little bit of a split response across yes, no, and not sure, which is totally okay if you're not sure. That's one of the goals we're hoping that you can get out of this partnership mapping exercise is you'll be able to start to identify who you work with at different stages and identify ways that you can strengthen those relationships over the course of the disaster cycle. All right, so, now that we're warmed up and we're starting to think a little bit about our partners, the next couple of slides that we're going to go through are just going to ask you to start to list some partners so we can start to think about who exactly they might be. I'll ask you all to post these answers in the chat box, but if you're comfortable or you want to use the raise hand feature, please feel free to come off and discuss anything you'd like or come off of mute. So first, asking you to think of 2 internal partners that you engage with during blue skies. So this is an emergency management term, blue skies. What it really just means is during steady state. So your day-to-day operations, it's when your community health center is not experiencing a disaster or emergency. So again, 2 internal partners. So these can be people that you work with within your own community health center during your day-to-day operations. And I'll give everyone a few seconds to post in the chat. Yeah, absolutely. A safety manager is so important. And then, of course, clinical staff, I imagine they're big parts of the internal team. Absolutely, C-suite staff. I am notorious for having IT issues, so I'm always working with our IT team, what feels like every single day. IT in the call center. Absolutely. I think for some of our organizations where we're a little smaller, it can be a little challenging to think through what internal partnerships may look like. So it can also just be one person that you work with who may just be your manager directly, or maybe if you use volunteers or interns at your site. So again, blue skies really just refers, it's a term typically used in emergency management, but when we say it, what we mean is another word could be steady state, or just really at a time when you're not experiencing an emergency or disaster. So really those day-to-day relationships, not during times when you're experiencing a surge in patients due to an emergency. All right, thank you all. So for our next question, moving on, we're gonna similarly think about during that steady state period or between disasters, but ask you to think of 2 external partners or 2 teams that you engage with during blue skies. And if you're able to call out the names, the specific names of those organizations, feel free to. We know that a lot of you are in the same region, so this could be a really great learning opportunity to learn about what partnerships might exist in your state or in your region. Healthcare coalitions is a great one, absolutely. City officials and first responders, Department of Public Health and the local hospital. Yes, these are all great responses. We recognize there are a lot of different emergency systems that may exist in your region, whether it be law enforcement, EMS, and then also, of course, your public health departments and the other health facilities you may engage with. All right, and then finally, we're going to ask you now to shift gears a little bit and think about the partners that you might engage with during a disaster. What we want you to think about here is really how your partners may change during times of emergencies. So again, 2 external partners that your community health center engages with during disasters. And these may be the same people that you work with during blue skies or steady state. That certainly may exist. There may be overlapped, or these may be external partners who you really only work with during a disaster. As an example, at Healthcare Ready, we engage with a couple of organizations who are able to support donation coordination during times of disaster. So we really lean into them to support some of our partners during disasters. Absolutely. Members of the coalition, yes, we know, of course, they engage in preparedness activities, but also there to support their members during times of response. Hospital and fire department. Same as above. Great. Yep, and again, we completely recognize these partners may be the same over the disaster cycle, which is great because those are those well-established and trusted partnerships we tend to lean on during times of emergencies. All right, so now that we've listed out some partners who we engage with at different levels and at different times, we're going to take some time to let you all map out your partnerships. So again, using that document that I dropped in the chat earlier, or if you can just feel free to jot this down on a piece of paper again, if that's easier. But what this will look like is in the left-hand column, you will list out a specific partner, then describe the needs of your community health center that these partners support. And then finally, describe what activities they undertake to help you in meeting those needs. So I'll give everyone about 2 minutes to work on that. I can redrop the file in case it got lost. And as you're working on that, I'll just keep talking a little bit. But again, this exercise is really to help you all get an idea of where your partners sit, who you call on for what, and from there, it can start to help you get a better sense for the gaps that remain and help you think through what partnerships you may be missing to fill those gaps. So we filled out some examples here for some of the partnerships that we think you may have at your community health center during normal operations. So again, on a regular day, in between emergencies, not during a disaster. And as you're working on this, really just want to underscore that this is an exercise and, a document that you can take away with you back to your community health center as a reference, not only for yourself, but for your whole organization. Having something like this accessible to your staff can be really helpful in making sure that your community health center has a strong understanding of your partnerships and where they can turn to for support. And then as you're wrapping up who you're thinking about that you work with during your normal operations, you can move on to start thinking about mapping out your partners in the context of an emergency event. So again, we've provided a few examples on the slide deck here. But of course, we welcome you to consider the unique partnerships that you may work with at your community health center. We know that not all community health centers are the same. Those of you who are located in Louisiana may have very different partners than Washington State because you deal with such different types of disasters. So again, we'll just give you all about a minute or so to start to think through these partners and the activities they support. Feel free to share any thoughts in the chat on some of the different partners you work with, or again, feel free to raise your hand and come off of mute. All right, so in the interest of time, I'll give everyone about 10 more seconds to wrap up their exercise. But again, continue to work on this when you leave this webinar, work on it with your staff. It's a really great document just to have on hand for your whole community health center. And thank you for participating in that exercise and sharing your thoughts in the chat. After you've gone through this exercise and you have your list of partners, this is a really great opportunity to look at the list and consider, is anyone missing? Are there organizations that you wish your community health center had a relationship? Looking at the needs column, do you notice any unmet needs that you're aware that your community health center has? Additionally, this could be a really good opportunity to look at your current partners and consider if there's anyone else who you wish you had a stronger relationship with. Do you have a really great experience with them in a past scenario, something like maybe a donation coordination? Or do you have an unmet need where, based on your relationship with them, you think they could also support you there? As we approach spring and early summer, before the 2022 hurricane and wildfire seasons, going through this exercise can be a really helpful way for you to begin planning which partners you may want to reach out to now and connect with them to really touch base and discuss how you may be able to work together in the future. This is something that we do at Healthcare Ready often. We find that making that first round of introduction during steady state is extremely helpful in laying the foundation of a successful partnership, so that when disaster strikes, you already know who to go to. And on the flip side, they're also equipped with the background knowledge of your community health center, and they may be able to better assist you. So following that exercise, I'm just going to put a quick poll on the screen just to ask, as you reflect on that exercise, if going through it helped you identify any other organizations that you'd like your community health center to partner with in the future. All right, seeing a lot of yeses, which is great. And again, you can share this document with your staff, take it home with you. It's for yours to use in the future. And all right, so I'm going to take a little break from some of our exercises we have planned and talk a little bit about the response systems that are in place and go over some of the partnership structures that you may be able to turn to during a disaster scenario. Okay, so first, I'm just going to talk through some of the various emergency response systems that exist at the community, local, and state and federal levels. We recognize that there are a lot of layers to the US response system, so just want to walk through a few of those pieces. So at the community response level, this is where you may see businesses, nonprofits, health facilities like hospitals or pharmacies, or other businesses with a local footprint activating their business continuity or emergency response plans to help your community respond. At this level, you may also see local businesses donating water or food supplies to shelters for evacuated individuals, or national organizations with a local footprint activating that local entity. At the state and local level, you may see coordinating bodies having a more active role in health-specific response efforts. They may likely be supporting bidirectional information sharing, in which your community health center can communicate your needs, or also where you may be able to assist. You may also see resource support happening at this level, where healthcare coalitions or HCCs or business emergency operation centers or BEOCs helping to facilitate the movement of supplies to areas in need. And then at the federal level, we have FEMA and ASPR who may be able to bring in support at the request of your state. And also CISA, who supports critical infrastructure coordination and cybersecurity related issues. And they also may be able to support at the request of your state. So the next 3 slides just provide some resources for each of those levels. starting with community-based emergency response organizations. So we have the VOADs, or volunteer organizations active in disasters. The first being the National VOAD, which is the National Coalition of the nation's most reputable faith-based, community-based, and nonprofit organizations. And then at the state level, it's the same thing, just a coalition of those state and local nonprofit organizations. The VOAD is made up of organizations that support response efforts in some capacity. We also have United Way and 211, which is a free and confidential service that helps people across North America find local resources that they need 24 hours a day, 7 days a week. You'll be able to find your state 211, usually just by giving it a quick Google and heading to their website. It's able to connect callers to state and local resources that supports long-term recovery. And then lastly, the Chamber of Commerce, which is the world's largest business organization with members ranging from small businesses that support communities to leading industry associations and corporations. The Chamber of Commerce is a trusted advocate, partner, and network to help businesses strengthen their communities. So they are a great organization to plug into. We know that businesses are huge anchor institutions when it comes to community resilience and helping communities get back to their normal operations after a disaster. So this could be a great resource to reach out to following an event. And then again, on the state and local response side, I know we've mentioned healthcare coalitions. These are supported by HHS ASPR, and they are a group of individual healthcare and response organizations in a defined geographic area. We also have Emergency Support Function 8, which is for public health and medical. They're responsible for coordinating the response during emergency situations, and it's all typically coordinated through the State Emergency Operations Center. And then we also have the Business Emergency Operations Center. Sometimes employees are known as private sector liaisons. These provide spaces for two-way information sharing between public and private sector stakeholders. So again, at the state and local response level, you'll see a lot of information sharing and coordination going on. And then lastly, at the federal response level, all of these agencies have regional offices. So these links here will be able to send you to where you can find your regional contact, depending on when you're located. And we'll share these slides with you following this webinar. So we've talked a lot about, different partnerships that you can plug into, but something we want to recognize is that building a new partnership can be really challenging, even if you know where to plug into. We recognize that many of you at community health centers are already wearing several different hats and you have many different roles. And it can feel overwhelming or challenging in that you may not have the time or resources to work on creating new partnerships. But we really just want to underscore that there are things that you can do at low cost and use little resources that can help to build those relationships, which eventually will make other parts of your job easier and benefit your health center and community as a whole. So again, there really is no right or wrong way to have a partnership. For the leaders and managers out here, or those who have been involved in emergency preparedness for many years, we encourage you to think of ways that you can help support your staff in building partnerships. And for those of you who are new to this or who may work on partnerships frequently, these are just some examples of some goals that you may want to consider as you foster those new relationships. So with that, we're going to jump into our scenario-based discussion. The focus here is really to bring together everything that we've talked about so far and think about what partnerships look like when multiple disasters impact our communities, which unfortunately is the reality that many of us are facing these days. During this discussion, really want you all to come off of mute if you're able to, or please use the chat feature, type your ideas and participate as much as you're able to. I'm going to be laying out the scenario here, but it's really for your engagement and your feedback. It will require you to consider your current partnerships, the partnerships you'd like to forge, as well as your community health center's needs. So feel free to refer back to your partnership map that you created earlier in the webinar as well. Just like real life, the scenario is not going to be perfect and you may have unmet needs. So lean into those, share them with the group, and there might be someone who has an idea of how partnerships can support you going forward. All right, so setting the scene, we're fast forwarding a little bit to September 2022. On the COVID front, there have been outbreaks of COVID in many areas since schools have reopened. And based on the data that is available, a new variant has been identified and it spreads quickly. Also, severe weather wise, for our Gulf Coast and East Coast states, a Category 4 hurricane has impacted the Gulf Coast and parts of the eastern coast. Strong winds and heavy rains have caused flooding in many areas, as well as infrastructure damage. And then for our states located in the West, dry weathers and heavy winds in the West have caused wildfires, which are spreading through many communities, causing evacuations. So on day one, due to the severe weather in our hurricane impacted states, in your state, flash flooding and river flooding has left communities underwater. 80% of your state's power has gone offline and nearly all community health centers have lost power. In our wildfire impacted states, in your state, the fires have caused power outages and many counties are under evacuation orders. Most community health centers are without power and some have even been forced to evacuate or close. So first, want to just focus on some of those internal partnerships or internal relationships that your community health center will likely first want to check on during this situation. So how do you check in on staff and patients at your community health center? And again, feel free to write in the chat. At our organization, when power's out or people may not have access to their laptops, we use WhatsApp or a texting chain so we're able to get in touch with our staff. Emergency call lists, yeah, very similarly, anywhere where you can have a phone number written down is a great thing to reference when your systems may be down.
Also promoting everyone to be able to chat too. So feel free to just come off mute and share.
Yeah, absolutely. Again, using text message is a great way just to quickly check in. And if you have patients' phone numbers, if you're concerned about them, you may be able to get in touch with them that way if you haven't been able to make contact with them following a disaster. All right, thank you all for sharing. So now that you have checked in on your staff and patients, let's say everyone's accounted for, you've been able to get in touch with everyone. What is your primary concern at this point? It's day one. It's not totally clear when power may be coming back online. What are some of the first things that you're starting to check in on? I think for some of us, we may have power generators that we're able to use. So, there may not be an immediate concern about power, but starting to think about how we may be able to maintain any supplies that need cold storage going down the future, maybe something we're starting to think about. Vaccines, yeah, absolutely. Something that may require cold storage or any of those supplies that you may need to get on hand, replenish those vaccine supplies, that may also be a concern. Determining how and when you can safely reopen, absolutely. We know many of you are the first point of contact for a lot of your community members. So, figuring out when you can accept patients, I'm sure is a huge concern for many of you. Or figuring out how you can utilize alternative locations, temporary or otherwise, absolutely. All right, so moving on to days 2 and 3. For our hurricane impacted states, the flooding event was severe. Emergency management, our staff are limited due to the COVID response, and cleanup and recovery times are expected to take longer than previously expected. Similarly, in our wildfire impacted states, the fires are continuing to spread, firefighters are limited, and experts are anticipating prolonged recovery times for affected communities. So kind of, going off to your point, Deirdre, if you're needing to think about alternative locations or temporary solutions, how are you coordinating with your primary care association to communicate your needs? Or how are you able to communicate your needs with any other external partners other than your primary care association? Feel free to mention who the first partner that you reach out to might be.
Sometimes when we have this conversation, we also hear different things from different regions. So for instance, in our last conversation, in a southern state, not to be named, a lot of the PCAs talked about reaching out to their fire departments first or their police departments. That was a common answer. Curious if any of you also reach out to your HCCs as well. That's really interesting, Deirdre. Do you also work with volunteers or organizations that help you to identify volunteers? I know that doesn't work in all health centers, but
Oh, okay. Just want to give you a heads up. Just found out today, and I talked to
the let's see, other things that we also hear for communicating needs.
I know a couple of people earlier mentioned other health facilities like hospitals in their region. You may be reaching out to shelters to understand medical needs at the different shelters in your area as well.
Absolutely. So, as you're communicating some of your needs, I know we saw earlier some people mentioning the different functions that would be prioritized at this point. I just kind of want to underscore that what you're prioritizing certainly will vary across different community health centers, but how you're communicating those prioritizations, both internally with your staff and externally, is critically important. Something we mentioned early on with internal partnerships, it's really important to maintain buy-in, to make sure that, everyone is on the same page during a response. So, you can bring in your C-suites, executives, leadership team to work with you to communicate how you're going to be managing a response across all of the teams at your organization.
Yeah.
Okay, so moving on to day 4. Later in the day on day 4, a cyber attack hits the nation while you are navigating this phase of COVID and dealing with your hurricane or wildfire recovery. While resources were strained, attackers had targeted health facilities, and now your community health center is experiencing system-wide outages. Power recovery is ongoing, but it's slow, and this is hampering your community health center's response significantly. So with everything going on, I want you all to think about how you would handle this. What is your protocol? Who is the first internal and external partners that you contact when dealing with a cyber attack in this scenario? As you're thinking about this and sharing some of your responses in the chat, I just want to note that it's okay if you don't have all the answers. I don't think many of us would in this type of scenario. You may even be thinking, this will never happen to me. But I really just want to emphasize enough how important it is to think through these potential situations. We want to get your brain going, thinking about what you would do. Unfortunately, we are seeing a significant rise in cyber attacks right now. And while we never want it to affect any of you or your community health centers, by taking the time to think through how you may handle this now, you could potentially save lives should this happen, because you know how to act quickly and who you can turn to for help.
We also have, we just recently held the cybersecurity webinar training too. And some of the questions that we got from there, obviously after a cyber event attack, one of your first places that you're going to reach out to are your IT teams. But beyond that, how are you going to employ your cybersecurity plan in terms of notifying patients that appointments are canceled if your systems are down? How will you ensure continuity of care if EMR systems are not available, for instance? So this, in the context of days 1, 2, and 3 of events, can be extremely challenging, as Melanie just covered also. One common question that we got during the cybersecurity webinar was, after your IT team, who do you contact if you're supposed to contact anyone else? Usually your IT team will be able to handle that. There are resources that are available in terms of making sure where to report the incident, whether it's with the FBI or with CISA, another federal agency who manages cyber attacks. If you're interested in that information, we are happy to dive in as well. Welcome all questions.
Thanks, Angie. So yeah, again, just, we're throwing all these scenarios in here just to make sure that you're all thinking about it. And, you can bring it back to your team and say, I actually did not know the answer to this. What would we do? And think it through together as a team so that everyone is prepared for the worst. And then I don't want to spend too much time on this slide. But again, over the last 2 years, we've learned that we still have to manage COVID in the face of other disasters. In this scenario, with the rise in COVID cases, it'll be important to keep in mind how you will continue to administer testing, vaccinations, or treatment if those are the services that you were providing prior to the disasters. During the scenario, we want you to think about the partners that you've worked with over the course of the pandemic and consider reaching out to them to see if they can assist with the challenges you're experiencing. Or if they're able to connect you with other organizations. That's something that we practice often. We reach out to people and just say, hey, we're looking for help here. Do you have anyone else that we can get in touch with? It's really helped foster some unique partnerships in the face of really unprecedented challenges and overlapping disasters. So I know we saw someone earlier mention that, vaccines would be a really big concern during the scenario. We know that the COVID vaccines require special storage with their cold requirements. So yeah, definitely with something like this, we would all need to be thinking about those supply considerations, as well as how we would continue to administer them in the face of challenges. And then lastly, moving on to part 4, we're seeing the light at the end of the tunnel. Restoring operations are ongoing. Ransomware attacks have been managed, and COVID-19 cases are flattening. So, thinking to how your team approaches recovery, is that something that you all have a plan to do? Something that our organization does is we do after action reports or lessons learned, where we just talk through what went well, what didn't, what we can improve on going forward. And that's something that's been tremendously helpful for us. You can also invite your external partners to
Participate in that exercise as well. Gather information from them as you think through how they could help going forward or how you can help them. You know, it's important to check in on your external partners to understand what they may be going through and how you can support them. And part of that recovery phase is all about maintaining partnerships and engagement. We understand that can be especially challenging, you know, after a scenario that we just threw at you, when people were stretched really thin, you know, people may be experiencing burnout from the last 2 years, or maybe they just really want to focus on, you know, getting their organization back on their feet first. Something that we've learned and we want to really emphasize is that when it comes to partnerships, you know, you have to meet people halfway sometimes. And make sure that they're benefiting from your partnership just as much as you may be. So, you know, we just want to close out this webinar with sharing some tips to how you can maintain engagement with your partners, which can include, you know, frequent check-ins or touch points, conducting testing and exercises. You know, you can take a scenario like we just did and create a whole tabletop exercise off of it and invite your partners to participate, where you're working through some of the ways that you could work together if something like this were to happen. I know earlier in the webinar, someone mentioned they would be interested in learning what type of messaging to share with partners. One way to do that is to define what you see your roles and responsibilities could be in a partnership and the type of value you may be able to add to their organization. You know, people want to know sometimes what they're going to get out of a partnership. So make sure you figure out what type of value you can have, know your strengths, and, you know, be excited to share that with partners. Let them know how working with you can really change their organization as well. And then finally, information sharing. If you create any type of situation reports, assessments, I saw someone just, Deirdre mentioned that, you know, AAR's analysis of failures, best practices moving forward. Be open to sharing bits and pieces of those with your external partners. They may be able to learn from those documents as well. And then finally, you know, with a time where we're seeing a lot of turnover with staff, make sure you're refreshing your contacts at least annually so that you know the right person to reach out to at your partner organizations. It'll save everyone a lot of time, and it's just a great way to keep up to date with your partners. So with that, you know, we hope that this exercises that we did today were helpful in starting to help you think about your partnerships and ways you can either build new ones or strengthen your existing ones. We have an assessment at the end of this webinar, which will pop up for you. We would really appreciate your feedback on this training. It will help us in developing future trainings for the Archer Initiative and other ones going forward. And then lastly, we do have an upcoming webinar on crisis standards of communication for the Archer Initiative. We will share these slides with you after this webinar, so you'll be able to click on the registration link there. And with that, please feel free to always stay connected to Healthcare Ready. We, you know, I've been really enjoying this Archer Initiative and working with community health centers and primary care associations directly. So if you have any questions, please don't hesitate to reach out to our team at any time. So with that,